In the winter of 2006, Northwest was hit by the worst windstorm in decades. This windstorm knocked up power to more than 1.5 million homes. Tragically, 400 people died, and area emergency rooms was inundated with 100 people suffered from carbon monoxide toxicity, so they needed hyperbaric oxygen therapy. So carbon monoxide is a silent killer, which is colorless, odorless, tasteless gas that is slightly less dense than air. Common sources of carbon monoxide in our homes include fuel-burning appliances and devices such as furnaces or boilers, gas stoves and ovens, fireplaces, both gas and wood burnings, water heaters, wood stoves, tobacco smoking, power generations, and finally, motor vehicles. Carbon monoxide poisoning is caused by inhalation of combustion fumes. The body replaces the oxygen in your red blood cells with carbon monoxide and binds with it strongly. So, this prevents oxygen from reaching your tissues and organs. Carbon monoxide have a lot of symptoms. Some of them are moderate and others are critical. Symptoms differ according to the level of carbon monoxide in blood. At low level, symptoms can be similar to those of other conditions, such as food poisoning and flu. The most common symptoms include headache, nausea and vomiting, dizziness, tiredness and confusion, stomach pain, shortness of breath. On the other side, if you have breathed in high levels of carbon monoxide gas, it's likely that you'll experience more severe symptoms. This may include impaired mental state and personality changes, vertigo, which is the feeling that you are spinning, ataxia, which is loss of physical coordination caused by underlying damage to the brain and nervous system, restlessness and tachycardia, chest pain, which is caused by angina or heart attack, and the most characteristic symptom is cherry pink skin. Finally, loss of consciousness in case where there are high levels of carbon monoxide, thus may occur within minutes. Carbon monoxide can also cause some complications depending on severity and length of exposure, such as number 1, permanent brain damage, which cause memory problems, difficulty in concentration, vision loss, hearing loss. Number 2, damage to the heart that could possibly lead to life-threatening cardiac complications. Number 3, carbon monoxide could be harmful to unborn babies, as it can cause low birth weight, behavioral problems, and perinatal death, which means that infants are still alive and death occurs within the first 4 weeks of birth. Number 4, death. Management. Management is the most important part in dealing with carbon monoxide toxicity. It helps protect heart and brain tissues, which are particularly vulnerable to injury from carbon monoxide poisoning. Move the person away from carbon monoxide early. If the person is unconscious, check for injuries before moving. Turn off carbon monoxide source if you can do so safely. Perform CPR for 1 minute before calling emergency if you are alone. Otherwise, have someone else call and begin CPR. Continue CPR until the person begins breathing or emergency help arrives. Once at the hospital, treatment depends on the severity of carbon monoxide exposure. In mild exposure, you must breathe pure oxygen through a mask placed over your nose and mouth in the emergency room, as this helps oxygen reach your organs and tissues. If you can't breathe on your own, a ventilator may do the breathing for you. But in the severe exposure, you must spend time in a pressurized oxygen chamber, as hyperbaric oxygen therapy is recommended. This therapy involves breathing pure oxygen in a chamber in which the air pressure is about 2 to 3 times higher than normal, as this speeds the replacement of carbon monoxide with oxygen in your blood. Finally, if you suspect carbon monoxide is present, follow this simple guide. Turn off or extinguish the heating source. Air ventilate your home by opening windows and doors. Stay outside in the fresh air. Seek medical help if you feel unwell. Keep some heating sources appliances off until surface or chimney cleaned by qualified professionals.